हेलो एवरीवन, वेलकम टू आवर सीरीज बूस्ट योर बेसिक्स। आज हम पोसोलॉजी के बारे में पढ़ेंगे एंड अंडर पोसोलॉजी यू हैव टू लर्न टू important थिंग्स. ओके, फर्स्ट वन आर द फैक्टर्स which influence the dose of a drug, and the other one are different formulas which are used to calculate the dose of a child. So according to your entrance test point of view, आपके लिए जो important है वो है examples under these factors and these different formulas. Okay, and we'll also solve few MCQs today. So let's start. Posology. So what is posology? It is derived from a Greek word that is posos, meaning how much, and logos, meaning science. And it is a branch of medical science which deals with dose or a quantity of drugs which can be administered to a patient in order to get a desired pharmacological action. And there are various factors which influence this dose or a quantity of drugs. And these are age, gender, body weight, route of administration, time of administration, metabolic disturbances, emotional factors, presence of disease, accumulation, additive effect, synergism, antagonism, idiosyncrasy, then environmental factors, tachyphylaxis, and tolerance. Okay, so we'll see each and every factor in detail. So let's start with the first one, that is age. सबसे पहले है age. So हम जानते हैं कि there are different classes of patients like pediatric class of patient, geriatric class of patient, adults, okay? And the pharmacokinetics of many drugs changes with the age or varies with the age, okay? अभी यहाँ पर दिया है children, okay? Children यानी pediatric class of patients, okay? So अगर हमने pediatric class of patients and adults को compare किया, okay? तो हमें बहुत सारे differences दिखाई देंगे, जैसे कि total body water वेरी होगा. ओके, अगर टोटल बॉडी वाटर वेरी होगा तो वॉल्यूम ऑफ डिस्ट्रीब्यूशन भी वेरी होगा. देन बॉडी सरफेस एरिया, देन बॉडी वेट, एल्बुमिन कंटेंट. ओके, दिस थिंग्स विल वेरी. एंड मोस्ट इंपॉर्टेंट थिंग्स आर जो एक्सक्रीटिंग या फिर मेटाबोलाइजिंग ऑर्गन्स है, ओके, लाइक लीवर, किडनी, ओके, दे आर पुअरली डेवलप्ड इन पीडियाट्रिक क्लास ऑफ पेशेंट and hence the chances of toxicity increases, right? Same way in old people, okay? ये old people यानी geriatric class of patients, okay? इनके भी जो organs होते हैं like liver, then kidney, okay, they become less efficient, or age related changes in hepatic and renal functions occurs, okay, which further alters the clearance of drugs, and hence the chances of toxicity are there. That's why they need a lesser amount of drug than the normal adult dose, because they are unable to excrete drugs to that extent as adults, okay? Then children can tolerate relatively larger amounts of belladonna, digitalis and ethanol, okay? Now you might be wondering that अभी हमने पढ़ा कि children यानी pediatric class of patients के लिए कम डोज चाहिए होता है एज कम्पेयर टू एडल्ट डोज, ओके? लेकिन यहाँ पर दिया है कि दिस फ्यू एग्जांपल्स व्हिच आर गिवन लाइक बेलाडोना, डिजिटलिस, इथेनॉल, ओके, दे कैन टॉलरेट रिलेटिवली लार्जर अमाउंट्स, ओके? ऐसा क्यों दिया है? सो आई विल एक्सप्लेन यू विद द एग्जांपल, ओके? आई विल टेक द एग्जांपल ऑफ डिजिटलिस. Okay, if any young infant, okay, he or she is suffering from congestive cardiac failure and he has been given this drug digitalis, okay, तो उन बच्चों में it requires around 4 to 6 times higher dose of digitalis as compared to adults, okay? और इतना ज्यादा डोज क्यों चाहिए होता है? Okay, there can be two reasons. First reason, प्रोटीन बाइंडिंग बहुत ज्यादा होता है, ओके? दिस डिजिटलिस का यंग इन्फेंट्स में प्रोटीन बाइंडिंग बहुत ज्यादा होता है. एंड अनदर रीजन कैन बी द एक्सक्रीशन ऑफ द ड्रग और एलिमिनेशन ऑफ द ड्रग इज वेरी हाई, ओके, in this young infants. That's why they require the higher or large amount of dose, or they can tolerate the large amount of dose of digitalis. Okay, ये एक example है. Then next one is elderly patients are more sensitive to some drugs like hypnotics, tranquilizers, which may produce confusion states in them. Okay, then we'll see one table. Okay, you will get different range of these ages, okay, in from different sources, but this is a generalized one. Okay, so first one, newborn. Newborn हम किसे कहते हैं? First few hours of life, okay? Then neonates यानी newborn to around 1 month of age. Then infants यानी 1 month to 1 year of age. Toddler यानी 1 to 3 years of age, okay? Children यानी more than 2 to 12 to 17 years of age, okay? Then adolescents more than 12 years to 21 years of age, okay? देन विल सी वन एग्जांपल. हम सबको पता है कि ग्रे बेबी सिंड्रोम क्या है, ओके, एंड इट इज कॉज्ड बाय द ड्रग क्लोरामफेनिकॉल. क्लोरामफेनिकॉल इज व्हाट? इट इज एन एंटीबायोटिक. एंड व्हाट इज इट्स मैकेनिज्म ऑफ एक्शन? ये क्या करता है? जो पेप्टिडिल ट्रांसफरेज एंजाइम है, ओके, जो पेप्टाइड बॉन्ड फॉर्म करता है बिटवीन टू अमाइनो एसिड्स इन प्रोटीन सिंथेसिस, उसको ये ड्रग ब्लॉक करता है, ओके. And whenever this drug was given in premature babies, okay, वो क्या करता है? वो accumulate हो जाता है and it causes different symptoms like cardiac irregularities, then gray discoloration of skin, reduced body temperature, okay. और ऐसा क्यों होता है? क्योंकि ये जो क्लोरामफेनिकॉल है, okay, it is actually a polar drug and it undergoes the phase 2 conjugation, that is glucuronide conjugation, okay, to get eliminated from the body. और प्री मैच्योर बेबीज में हमने अभी देखा कि उनमें जो लीवर या फिर किडनी है वो प्रॉपर्ली डेवलप नहीं होती है, ओके, इमैच्योर होती है, एंड दैट्स व्हाई दे कैन नॉट फॉर्म दिस ग्लूकोरोनाइड कॉन्जुगेशन एंड हेंस दिस क्लोरामफेनिकॉल कैन नॉट बी एलिमिनेटेड फ्रॉम द बॉडी, ओके, एंड इट गेट्स एक्यूमुलेटेड. और जब ये क्लोरामफेनिकॉल एक्यूमुलेट हो जाता है, वो क्या करता है? इट इंटरफियर्स विद द माइटोकॉन्ड्रियल रेस्पिरेशन, ओके, एंड ड्यू टू दिस द लेवल्स ऑफ ऑक्सीजन डिक्रीजेस इन आवर बॉडी, ओके, एंड the levels of oxygen decreases, that means cyanosis occurs, that is bluish to grayish color of the skin, okay. That's why we can see this different symptoms, okay, grayish discoloration of skin, okay. This is one example. Now let's see the next one. Gender. Okay, so women do not always respond to the action of drugs in the same manner as men, okay. Morphine and barbiturates are the drugs which produce more excitement before sedation in women, okay, and we have to take special care when we are administering a drug during menstruation, pregnancy, and lactation, okay. And we know that there are various drugs which are acting as a teratogen, okay, for the fetus, like alcohol, barbiturates, narcotic, non-narcotic, okay, which crosses the placenta and reach the fetus. So we'll see one example, thalidomide disaster, okay. आपने ये सुना होगा, it happened in 1958. And क्या हुआ था कि ये जो थैलिडोमाइड ड्रग है, okay, it was given to the pregnant ladies, okay, for the anti morning sickness action, okay. और ये जब फर्स्ट ट्राइमेस्टर में दिया था in pregnancy, okay, तब जब बेबीज जो हुए, okay, उनमें this kind of symptoms were there, okay, like this kind of defects were there. Phocomelia, that is seal like limbs, hands and feet arising almost directly from the shoulders and pelvis, and multiple defects of internal organs occurred, okay, and that's why it was immediately withdrawn from the market. लेकिन फिर से ये reintroduce हुआ था with restricted use, okay, only in the cancer therapy, okay, as an anti-cancer drug. ये फिर से reintroduce हुआ था, okay. The next one is tetracycline. Tetracycline is secreted or excreted in the milk, okay, and they affect the bones and teeth of the fetus if given during pregnancy, okay. Hence, we have to take precautions or care should be taken, okay, when these drugs are taken. Then we have body weight. So body weight, the average dose is mentioned either in terms of mg per kg of body weight, okay, or as a total single dose for an adult weighing around 50 to 100 kg, okay. Average is taken, that is 70 kg. However, the dose expressed in this fashion may not be applied in case of obese, then children, malnourished patients, okay. ऐसा क्यों होता है? क्योंकि हम जानते हैं कि obese patients यानी obviously उनका weight ज्यादा होगा, okay, fat content ज्यादा होगा, okay, so the changes will be there. Then children हमने last slide पे देखा था, okay, and even the malnourished patients, okay, so we have to calculate according to the body weight. Then next one, route of administration. हम किस रूट से लेते हैं एनी ड्रग, दैट ऑल्सो मैटर्स अ लॉट, ओके. अगर हमने इंट्राविनस रूट से अगर हमने कोई डोज दिया, ओके, देन विल हैव अ इमीडिएट एक्शन, ओके, विल गेट अ क्विक एक्शन, drug action. Why? Because this drug will directly enter the systemic circulation or the blood, right? And hence it requires a smaller doses than ones which are required in oral doses, okay. So due to this reason, the onset of drug action is very quick in intravenous route, and this might enhance the chances of drug toxicity as well, okay. The effectiveness of drug formulation is generally controlled by the route of administration. देन वी हैव टाइम ऑफ एडमिनिस्ट्रेशन. ओके, हम किस टाइम पे लेते हैं, यानी कि बिफोर ब्रेकफास्ट, आफ्टर ब्रेकफास्ट, बिफोर मील्स, आफ्टर मील्स. ओके, दैट ऑल्सो मैटर्स. जब हमारे स्टमक में फूड प्रेजेंट होता है, ओके, दैट टाइम इट डिलेज द एब्जॉर्प्शन ऑफ द ड्रग्स. ओके, अगर हमें कौन सा भी ड्रग बहुत जल्दी से एब्जॉर्ब करना है, ओके, दैट टाइम इट शुड बी गिवन एन एम्प्टी स्टमक. व्हाई? बिकॉज ड्रग्स आर मोर रैपिडली एब्जॉर्ब फ्रॉम द एम्प्टी स्टमक. ओके, so the amount of drug which is very effective when taken before meal may not be as effective when taken during or after meals. Okay, एंड हम कब जब हम गैस्ट्रिक एम्पटिंग, ओके, आपने टर्म सुना होगा गैस्ट्रिक एम्पटिंग. गैस्ट्रिक एम्पटिंग यानी जो स्टमक में कंटेंट है, ओके, इट पासिस थ्रू द इंटेस्टाइन. ओके, सो हमें गैस्ट्रिक एम्पटिंग कब रैपिड करनी है और कब हमें गैस्ट्रिक एम्पटिंग डिले करनी है, ओके, इट डिपेंड्स अपॉन द ड्रग. फॉर एग्जांपल, अगर हमें रैपिड गैस्ट्रिक एम्पटिंग चाहिए, ओके, इन केस ऑफ ड्रग्स लाइक एरिथ्रोमाइसिन, पेनिसिलिन जी. ओके, ऐसा क्यों होता है? क्योंकि जो पेनिसिलिन जी है या एरिथ्रोमाइसिन है वो एसिड में अनस्टेबल है. ओके, एंड दैट्स व्हाई वी रिक्वायर अ क्विक और रैपिड गैस्ट्रिक एम्पटिंग. ओके, एंड समटाइम्स वी रिक्वायर अ डिलेड इन गैस्ट्रिक एम्पटिंग. ओके, ये कौन से ड्रग के साथ होता है? जैसे कि ग्रिसियोफुल्विन. ओके, ग्रिसियोफुल्विन डजंट dissolve well in the GI fluids. Okay, that's why we require the larger amount of contact time between the griseofulvin and the GI fluids. Okay, and that time to increase the dissolution. Okay, and that time we are doing what? We are delaying the gastric emptying time. Okay, and other things are like irritating drugs, okay, which are better tolerated if administered after meals. Example are iron, cod liver oil. Okay, they should be given after meals. Then next one is environmental factors. Daylight is a stimulant, enhancing the effect of stimulating drugs and diminishing the effects of hypnotics. Okay, and darkness is a sedative. Like hypnotics are more effective at night. The amount of barbiturate, that is any sedative, required to produce sleep during the daytime is much higher. Why? Because daytime is a stimulant or daylight is a stimulant. Then the dose required to produce sleep at night. Alcohol is better tolerated. This is another example. Alcohol is better tolerated in cold environments than the summer. Then in summer. Then next one are the emotional factors. The personality and behavior of a physician may influence the effect of drug, especially when drugs are intended for the use in psychosomatic disorder. And the females are more emotional than males, and hence they require the lesser amount of dose. Then next one are the presence of disease. Okay, presence of disease भी matter करता है, जैसे कि in case of barbiturates. Okay, barbiturates action may be prolonged when patient is suffering from liver cirrhosis. Okay, next example है streptomycin का. Streptomycin is a drug, okay, which is excreted mainly through the kidney. Okay, and if the patient is suffering from kidney failure, or if the patient's kidney is not functioning properly, what will happen? This streptomycin will prove toxic, okay, to the body. The next one is accumulation. The drugs which are slowly excreted may build up sufficiently high concentration in the body and produce the toxic symptoms if it is repeatedly administered for a longer period of time. Okay, अगर कोई drug जो slowly excrete होता है, okay, उसका rate of elimination बहुत slow है, okay, that time it will be it will get accumulate inside the body, and hence the toxicity will occur. Examples of these drugs are digitalis, imatine, then heavy metals. Okay, this occurs due to the accumulative effect of the drug. Then next one is synergism. So when two or more drugs, okay, जब हम दो या ज्यादा drugs देते हैं in combination, the action is increased. Okay, this phenomenon is nothing but synergism. Okay, अगर हमने individually वो drugs दिए तो they can have any action or they can be inert, but when they are given together the action will increase. Okay, and that is synergism. Example is levodopa and carbidopa as an anti-Parkinsonian drug. तो हमें पता है कि जो कार्बिडोपा है, इट इज अ डोपा डिकार्बोक्सिलेज इनहिबिटर, राइट. सो इट विल प्रिवेंट द पेरिफेरल metabolism or peripheral conversion of levodopa to dopamine, right, and hence more amount of levodopa is available to enter the brain. to show its anti-Parkinsonian action. Okay, this is example of synergism. Then next one, additive effect. When the total pharmacological action of two or more drugs administered together is equivalent to the sum of the individual pharmacological action, this phenomenon is called as additive effect. Example, combination of amlodipine and atenolol in the treatment of hypertension. Okay, we'll see some more examples under these additive drug combinations. Okay, aspirin, paracetamol, okay, together they are having greater action as analgesic and antipyretic. Then nitrous oxide and halothane as a general anesthetic. Then amlodipine and atenolol, जो हमने अभी देखा, okay, amlodipine and atenolol, they are having action as an antihypertensive. Then glibenclamide and metformin as a hypoglycemic, and ephedrine and theophylline as a bronchodilator. Okay. Then next one is antagonism. When the action of one drug is opposed, okay, antagonized or opposed by the other drug on the same physiological system is known as drug antagonism. The use of antagonistic responses to drugs is valuable in the treatment of poisoning. Okay, for example, यहाँ पर दिया है milk of magnesia, जो कि alkaline होता है, is given in acid poisoning when alkaline effect of milk of magnesia neutralizes the effect of acid poisoning. Okay, this is one example. Then we'll see different types of antagonism. Physical antagonism. Charcoal adsorbs the alkaloids and thus can prevent their absorption and hence used in alkaloidal poisoning. Then next one is chemical antagonism. Tannins plus alkaloids, okay, which are insoluble, they form, okay, tannins and alkaloids form insoluble tannate, okay, alkaloidal tannate. Okay, hence they are used, tannins are used in alkaloidal poisoning. Okay, and next one is physiological antagonism. जैसे कि insulin and glucagon, okay, they act on blood sugar level. Okay, their action is on blood sugar level, but their action is in opposite direction. That is, glucagon will increase the blood glucose level and insulin will decrease the blood glucose level. Okay, then we have next one, receptor antagonism. Okay, ये हमने बहुत बार देखा होगा, right? Anticholinergic will oppose the contraction of intestinal smooth muscles, muscle induced by cholinergic agonist, okay, but not that induced by histamine or 5-HT, that is 5-hydroxytryptamine, that is the serotonin. Okay, तो ये बहुत सारे एग्जाम्पल है इसके, जैसे कि एंजियोटेंसिन रिसेप्टर ब्लॉकर्स, ओके, दे आर कमिंग अंडर रिसेप्टर एंटागोनिज्म. Then next one is idiosyncrasy. An extraordinary response to a drug which is different from its pharmacological system, okay, is known as idiosyncrasy. Okay, and this is coming under type B of adverse reaction, okay, adverse drug events that are the bizarre type. Okay, an example for this is small quantity of aspirin may cause gastric hemorrhage and small dose of quinine may produce ringing in ears, okay, that is tinnitus or cramps, etc. Okay, then we have metabolic disturbances, changes in water electrolyte balance and acid base balance, then body temperature, other physiological factors may modify the effects of drugs. Okay, यहाँ पर example है salicylates का, कि salicylates reduce the body temperature only in case an individual has rise in body temperature. Okay, this is a requirement, and they have no antipyretic effect if the body temperature is normal. Then we have tolerance. Okay, tolerance when an unusually large dose of drug is required to elicit an effect ordinarily produced by the normal therapeutic dose of the drug. This phenomenon is termed as drug tolerance. Okay, तो मैं आपको एक example से समझाती हूँ. For example, any drug, okay, if it is producing its therapeutic effect at 500 mg, okay, but after some time or gradually what happens, this same 500 mg is not able to produce its therapeutic action. Okay, and that time it give rise to tolerance. Okay, agar and in this case what is the requirement is, we required a large amount of dose to elicit the same pharmacological or therapeutic action. Okay, example over here is smokers can tolerate nicotine, then alcoholic can tolerate large quantity of alcohol. Okay, Then next one, tachyphylaxis. Okay, so tachyphylaxis and tolerance are somewhat similar, but differences are there. Okay, like in tachyphylaxis, what happens? It has been observed that when certain drugs are administered repeatedly at shorter intervals, the cell receptor blocked up. Okay, and the pharmacological response to that particular drug is decreased. Okay, and it can occur after an initial dose or after a series of small doses. As in case of tolerance, हमने अभी देखा था कि in case of tolerance, what happens is it develops gradually. Okay, over the time it develops. But in tachyphylaxis, it can develop immediately after an initial dose or after a series of small dose. The decreased response cannot be reversed by increasing the dose. Okay, यहाँ पर last tolerance में हमने देखा था कि we can produce this therapeutic effect, okay, after increasing the dose. But in case of tachyphylaxis, what happens? We cannot reverse this particular acute tolerance. Okay, that is, decreased response cannot be reversed by increasing the dose, and this particular tachyphylaxis is also called as acute tolerance. For example, ephedrine, when given in repeated doses at short intervals in the treatment of bronchial asthma, may produce very less response due to the tachyphylaxis. Okay. Then now, next one, we'll see the formulas which are used in calculation of pediatric dose. First one, dose is proportionate to age. Okay. First one is Young's formula. Under Young's formula, we are having the formula as dose for the child is equal to age in years divided by age in years plus 12 into adult dose. Okay, and this formula is used for calculating the doses for children under 12 years of age. Then next one we are having is Dilling's formula. Okay, under Dilling's formula, it is the dose for the child is equal to age in years divided by 20 into adult dose. Okay, and this is used to calculate for the children between 4 to 20 years of age. The next one we are having dose proportionate to body weight. Okay, so first one is Clark's formula. Under Clark's formula, we are having dose for the child is equal to child's weight in kg divided by 70. Okay, 70 is the average weight of adult into adult dose. And one more formula we are having under this Clark's formula, that is in pounds. Okay, dose for the child is equal to child's weight in pounds divided by 150 into adult dose. And these are used to calculate for infants and children. Then next one is Freud's formula. Okay, Freud's formula is dose for the child is equal to child's age in months, okay, divided by 150 into adult dose. These are used for calculating the dose of an infant up to 24 months of age. Then we have Cowling's formula. Okay, this is dose for the child is equal to age at next birthday divided by 24 into adult dose. Okay, then we have best dose formula, that is dose for the child is equal to age in years divided by 30 into adult dose. Okay, ये जो सारे formulas है वे बहुत important है. Okay, the calculations can be asked from this part. Then calculation based on body surface area. Okay, so dose for the child is equal to body surface area of the child divided by 1.73 square meter. Okay, ये 1.73 square meter क्या है? It is the body surface area of a 70 kg adult. Okay, into adult dose. Now we have few more questions to solve, but before that, if you want more such videos, you can subscribe to our channels, Dharmesh Mehta GPAT. You can press the bell icon and you will be notified every time a video is posted. We also have a free WhatsApp group where we post daily 5 MCQs, and we also have classes. Okay, so if you want to enroll for the classes or if you want to get add on that groups, you can just contact on these numbers. You can mention your name, your college name, and we'll do the needful. So let's start with the question, MCQ part. Okay, so geriatric doses are lesser than the normal doses because options are because of their body size, because of their body weight, the immunity system is not working well, then slow drug clearance and increase the possibility of drug accumulation in the body and subsequent toxicity. ओके तो मोस्ट अप्रोप्रिएट जो आंसर है वो हमें टिक करना है या फिर मार्क करना है. ओके so first we'll see some solution part. Drug dose should be reduced in elderly. Okay, elderly patient because of a general decline in the body function with age. The body fat increases with age. Okay, and because of small volume of body water, okay, the volume of distribution will change, right? Like higher peak alcohol levels are observed in the elderly subject than in adults. Volume of distribution of water soluble drugs may decrease, and that of lipid soluble drugs like diazepam will increase with age. Okay, तो यहाँ पर जो most appropriate statement है, okay, because of their body size या body weight, okay, these are not the correct answers, right? Because हमें पूछा है कि जीरियाट्रिक क्लास ऑफ पेशेंट्स. ओके तो जो मेजर होगा उनका जो ऑर्गन्स है लाइक liver, okay, then kidney, they become less efficient, right? And because of that what happens, the toxicity chances are more, and because of that we require a lesser amount of dose, right? So the correct answer over here will be the D option, that is slow drug clearance, and that's why the increase in possibility of drug accumulation and subsequent toxicity. Okay, so the correct answer is D. The next question. Drug dosage may require adjustment of the usual adult dose for abnormally lean or obese patients because, okay, so first option A is normal doses are considered suitable for 70 kg, that is around 150 pounds individuals. Okay, then the ratio between the amount of drug administered and the size of the body influences the drug concentration at the site of action. Then both A and B are right statement, both A and B are wrong statements. Okay, so obese patients may and lean patients may, of course there will be a variations, okay, as compared to adult dose. In obese patient, what happens? The apparent volume of distribution of drug is greatly affected by the changes in the body weight, okay, since the body weight is directly related to the body fluids. Okay, तो हमें पता है कि हम जब नॉर्मल कैलकुलेशंस करते हैं तो हम एवरेज 70 kg वेट लेते हैं, राइट? सो यस, this will be correct, like normal doses are considered suitable for 70 kg individuals. Okay, and this statement is also correct. It is ratio between the amount of drug administered and the size of the body will influence the concentration at the site of action, right? So these both statements are correct in this case. So the option will C will be correct, that is both A and B are right statements. Okay, the next one is question 3. The policy to avoid tolerance development is, okay, first one, initiating therapy with lowest effective dose, then avoiding prolonged administration, only A, both A and B. So first we'll see what is tolerance. Okay, so tolerance refers to the requirement of higher dose of drug to produce a given response. Okay, हमने देखा था factors में कि tolerance क्या होता है, right? We required a higher amount of dose than the usual normal dose, okay, to produce the same therapeutic action. Loss of therapeutic efficacy after prolonged or intensive use of a drug, example beta 2 agonist in bronchial asthma, is generally called as refractoriness. Okay, then there are two kinds of tolerances, pharmacokinetic or drug disposition tolerance और pharmacodynamic और cellular tolerance. Okay, pharmacokinetics में क्या होता है, जो drug है that gets easily excreted or easily eliminate हो जाता है. Okay, and that's why we cannot see the action or the therapeutic action of the drug. Okay, and in pharmacodynamic what happens, there is a down regulation which is happening. Down regulation यानी क्या, there are receptors. Okay, बहुत सारे receptors है, लेकिन जो ड्रग है, ओके, इन टॉलरेंस व्हाट हैपेंस, ड्रग इज इन वेरी मच अमाउंट, लेकिन जो रिसेप्टर्स है वो बहुत ही कम है. ओके, एंड दैट टाइम व्हाट हैपन, डिसेंसिटाइजेशन ऑकर्स, दैट इज द डाउन रेगुलेशन. अप रेगुलेशन यानी रिसेप्टर्स बहुत सारे हैं, ओके, एंड ड्रग इज वेरी लेस, दैट टाइम इट इज कॉल्ड एज अप रेगुलेशन. बट इन डाउन रेगुलेशन व्हाट इज द केस, जो रिसेप्टर्स है वो बहुत कम है and drug amount is very much, okay, because of frequent administration. Okay, and that time what happened, desensitization, or we cannot see the therapeutic action of the drug, okay, in this kind of tolerance. So the correct option over here will be both A and B. Okay, the policy to avoid tolerance is initiating the therapy with the lowest effective dose, okay, and avoiding the prolonged administration of a drug. Then next one, sedative dose is required more in daytime than in night. ये भी हमने देखा था, right? We have seen that daylight is a stimulant and darkness is a sedative. So options are true. Darkness increases the activity of sedatives. False. Sunlight increases the activity of sedatives. Okay. Then true, because sedatives show better absorption at night. And false, because sedatives only show increased absorption at daytime. Okay. तो हमने देखा था कि डार्कनेस जो होता है वो सिडेटिवनेस को इंक्रीज करता है, राइट, एंड जो डे लाइट होती है वो स्टिमुलेंट होती है, राइट. सो वी हैव सीन दिस, डे लाइट इज अ स्टिमुलेंट which enhance the effect of stimulating drugs, okay, and diminishing the effect of hypnotics, and hence we require the larger amount of dose, okay, of sedatives in daytime than in nighttime. Okay, darkness is a sedative, hypnotics are more effective at night. The amount of barbiturate required to produce sleep during daytime is much higher than the dose required to produce sleep at night. Okay, so which statement will be correct? Statement A, that is true. Darkness increases the activity of sedative. Okay, hence we require lesser amount of drug at lesser amount of this sedative at night. The next one, placebos contain A, no active medicine but has a similar appearance as the original dosage form, more active medicine than the original dosage form, medicines that are cheaper than the original drugs, all of the above. Okay, so placebos यानी क्या? Placebos are the inert substances which is given in garb of medicine. Okay, medicines के जैसे ही दिया जाता है लेकिन उसमें active ingredient नहीं होता. Okay, it works by a psychodynamic rather than the pharmacodynamic means, and often produces responses which is equivalent to active ingredient. Okay, and these are given in two cases, like as a control device in clinical trials, as a dummy medication, okay, जिसमें active ingredient नहीं होता, and to treat a patients who in the opinion of physician does not actually require the active drug. Okay, so the correct option over here will be A, that is no active medicine but has a similar appearance. Okay, medicines के जैसे ही दिखता है, same way it is given. Okay, but active ingredient उसमें नहीं होता. Okay, as the original dosage form. Then next one, the schedule of dosing is called as dosage regimen, dosage inspection, then dose calibration, all of the above. So what is actually dosage regimen? Okay, schedule of dosing is called as dosage regimen. So what is dosage regimen? It is defined as the manner in which the drug is taken. Okay, so there are some drugs which require only once, but there are some drugs which require the continuous therapy, okay, like hypertensives and all. So optimal multiple dosage regimen is the one in which the drug is administered in a suitable doses by suitable route, which with sufficient frequency that ensures the maintenance of the plasma concentration within the therapeutic window without excessive fluctuations, okay, and drug accumulation for the entire duration of therapy. Okay, this is nothing but a dosage regimen. So the correct option over here will be dosage regimen. Then next one, using Young's formula or Young's rule, calculate the dose for a 5-year-old child if the adult dose is 340 mg. Okay, so this thing we have to solve with the help of these formulas. Okay, so we know that for Young's formula is what? Dose for the child is equal to age in years divided by age in years plus 12 into adult dose. Okay, so if we substitute, what we will get is 5 divided by 5 plus 12, that is 5 is the age in years of child, that will be equal to 100 mg. Okay, so the correct option will be 100 mg, okay, into adult dose, that is 340. Okay, so the correct option over here will be 100. Okay, next one, using Clark's formula, calculate the dose of a child weighing around 75 lbs if the adult dose is 300 mg. Okay, so we have to use now Clark's formula. Okay, so the weight over here is given in pounds. Okay, so we have to calculate dose for the child is equal to child's weight in pounds, that is around 75, divided by 150 into 300. 300 is the adult dose. and that will be equal to 150 mg. Okay, so if you are given in case of kgs, okay, you should know this conversion, that is 1 kg is equal to 2.205 pounds, or else you can use that particular formula, which is child's weight in kgs. Okay, so yes, so here correct answer will be 150 mg. So that's it for today. All the best for your exams. Thank you.